Welcome to our panellists and to everyone who's tuned in to today's session. So the purpose of today's careers panel is to give some insight into the breadth of careers within the NHS. And we're going to meet some allied health professionals and therapists who work in a variety of different disciplines. So in order to ask our panelists questions, if you could use the Q&A function on your screen. We hope to get some of your questions at the end of the panel. So we're going to be going through some questions first that we've had submitted already, and then at the end we'll try and get to your questions if we can, time permitting. So I'd like to first ask the panelists to introduce themselves and tell us a little bit about what you do. And we're going to start with the representatives from the Learning Difficulties Service at Enfield. So Shirley Ann, if you could start please, that would be great.
Thank you very much and welcome to this session. I work in Enfield as part of the Integrated Learning Disabilities Service. I am a head occupational therapist and I manage an employment service where OT, occupational therapy, takes a lead in working with adults with learning disabilities to get valued worker roles and paid employment.
Thank you. Adela, please.
Hey, I'm Adela, also occupational therapist on Shirley Ann's team, but a slightly different section of OT. So our team provide assessment and intervention, support people to manage their day-to-day activities. So that could be anything from helping the person manage their money, providing community safety education, supporting a person to learn to travel on public transport, making meals, leisure activities, managing home, relationships and sexuality. And we also support parents with learning disabilities who have children.
Thank you. Georgina.
Hiya everyone, my name's Georgina and I'm a speech and language therapist and I work in the same team as Shirley Ann and Adela. So that's the Enfield Learning Disabilities team. In terms of what I do, so I support adults with learning disabilities in the community who have communication difficulties, or they might have swallowing difficulties, which we call dysphagia as well. So that's, people don't always realise that we do sort of two things. So we are communication and swallowing difficulties. So that's what I do.
Thank you very much. And Rupa, please.
Hi, my name's Rupa Gon and I'm a clinical psychologist within the same team of the Enfield Integrated Learning Disabilities Service. I suppose what might be useful for you to know is that I've specialised in working with people with learning disabilities, and so that's supporting people who have learning disabilities and mental health problems or behaviours of concern. The role is broader than that because there's a preventative part of it as well. So we do assessments, we do therapy, and we work with the team as well to improve services for people with learning disabilities.
Thank you very much. And Nura. Nora, did you want to introduce yourself?
Hiya, so I'm Nora and I'm just in the session just to help out.
Okay, great.
Yeah, I'm Middlesex University.
Okay, and Skelchim.
Yep, so my name's Skelchim, as you all know, so I work in Great Ormond Street as a clinical physiologist in the speciality of neurophysiology. We basically carry out neurophysiology tests here, such as EEG and evoked potential tests, which is basically just looking at the functioning of the nervous system and from that deriving a test that we can read and hopefully help the patient with. We look at children with epilepsy, various encephalopathies, which is brain disorders and things like this. All right.
Thank you. Jude, please.
So hello, my name's Jude Monteith. I actually work in an acute trust, so probably what all of you think AHPs do, and none of them have so far. So I work for the Royal Free Trust at the moment. I am a consultant physiotherapist, which means that I've managed to bubble to the top of the tree, I guess you would say, the clinical tree at the least. My specialism at the moment is shoulders. So I work alongside the shoulder surgeons, and I do everything from making a diagnosis, ordering investigations from the rest of this team, telling patients what's wrong with them, listing them for surgery, explaining what their operation is going to be about, etc. So maybe not what you entirely think a physio does, but some of the rest of my jobs that you might hear about later have been more classically physiotherapy.
Thank you very much. And Michelle Gevers.
Hi, I'm Michelle. I'm a Pediatric Dietitian at the North Middlesex University Hospital. And I do a lot of inpatients and also outpatient work with pediatrics. So what I do as a dietitian is that we assess the patient, we diagnose and treat dietary and nutritional problems, and we do that in conjunction with looking at science and research, and we take that and we translate it into practical guidance to enable people to make appropriate lifestyle and food choices. I specialize on the neonatal unit, but that's getting more into depth with other things. But there's lots of different areas that you can go into as a dietitian.
Thank you very much. Michelle S, please.
Hi guys, I'm Michelle and I'm a hospital play specialist, and I work at the Royal National Orthopaedic Hospital, and that's a ward that's based, it's adolescent and paediatric, so we have patients from 0 to 17. The play specialist bit is a little bit misleading in my title. I will get the Lego out if you really ask me nicely, but a lot of it is about counselling children through and adolescents through their anxieties about the surgery that they're going to undertake and all of the horribleness that comes with that sort of, being in hospital and surgical. So that's what I do.
Thank you. Thank you. That's really interesting hearing all your different job roles, and it's really varied. So I'm going to start by coming to Adela first. Your role involves working with those who have learning disabilities. How is this different from a more general allied health professional role?
So I guess I'll just clarify what a learning disability is, because I know not everybody always knows that. So it's an IQ of 70 or below that has an impact on social functioning. And we usually mean that the person has difficulty with communicating. So I would say that the skill in what we do in working with people with learning disabilities is being skilled at adapting our communication to suit their need, and that will vary from client to client, just to ensure that they understand what's going on and they're able to express their sort of needs and preferences. So that would be one thing. And I suppose the other thing that might be different is you're often not just working with the person, but often working with families and carers as well. So there'll be usually a few people around that person, also with your own multidisciplinary team as well. So yeah, you're kind of rarely working in isolation, I would say. I think that's it.
Thank you. So I've got another question now for Shirley Ann. So could you tell us a little bit about what an occupational therapist does day to day? Sorry, you're on mute, Shirley Ann. Thank you.
That's a very broad question.
It is, yes.
And the role has very much changed over the years. My specific area is employment, and the employment ranges from people that have got long-term conditions with MS, who might, but also have learning disabilities, who need tasks broken down. But the other areas of occupational therapy range from pediatrics to working with older people, physical health, mental health, anybody that might have a problem with everyday living. Occupational therapists will use activities of daily living to actually treat the problem, very much into problem solving, working from a strength-based approach. What can you do, and how can we help you to actually get to the goal that you want to do. Our roles have changed over the years. We are in A&E work, doing frontline work when people are going into an emergency situation. We are on the wards. During COVID, your occupational therapists have actually been in intensive care doing the rehab, and traditionally we have been on discharge, rehab back into home, working in the community. Wherever we perform activities of daily living, work, home, leisure, then an occupational therapist can be helping you to progress your independent lives.
Thank you. That's a really thorough kind of but broad explanation. That's really helpful, I think. So my next question is for Skelchim. How did you find out about the field of neurophysiology, and what made you decide to train in that field?
So for me personally, I found it through friends and just my own research. And what made it, you asked what made it appealing for me?
Yeah, and yeah, what made you want to do that? Yeah.
Well, I always had a personal interest in neurology anyway, and this job kind of fits all of my criteria, because for me personally, I like to have patient contact. I like to learn about the various conditions that may affect people, for example, with epilepsy or other neurological conditions. So that also was a bonus for me. And I am also able to work alongside doctors, consultants, which will allow me to gain their expertise as well. And also the actual tests that I perform, I would be able to write my own reports based on what I can see on the tests. And the only thing I wouldn't do is, for example, say what clinical significance that has. But for me, an all-round job that, yeah, it's just very varied.
That's really interesting. Thank you. So my next question is for Michelle Gevers. What qualifications and experience do you need as a pediatric dietitian? And what kind of, what's your work really like? Is it working with just children who have problems with food or don't want to eat, or is it broader than that?
So to be a pediatric dietitian, well, to start with, to be a dietitian in general, you can do two types of programs at university, either full-time undergraduate BSc, which is like a 3 to 4 year program, or you can do a undergraduate degree and then do a full-time postgraduate, either diploma or master's in dietetics. So once you've done dietetics, either route, you can then, you probably want to just get a grounding of dietetics in general, but then you can specialize into different areas of nutrition, and pediatrics being one of them. So here in the UK, the British Dietetic Association has modules where you can, it's quite intensive. I think there's 5 different modules, and you can then go into each of the areas of pediatrics. I have a background of being a dietitian in South Africa, where we do it as part of our undergraduate course. So either route, and then you just get experience and build up that knowledge base of working with children and families, because it's not just in isolation. We're looking at both patient groups together. So I'm in neonatal pediatrics, so mostly work with preterm infants. So those are children that are born early. And you probably traditionally think of a dietitian as just with a healthy eating and maybe weight loss. So what we do, what I do on the neonatal unit is most of those children, they not yet able to feed orally. So we feed them through a tube or through their veins. And so we have to carefully calculate what their nutritional needs are, and make sure that we develop eating regimens or feeding regimes that meet those requirements, so that they can grow and have positive health outcomes later on in life. So it's not just healthy eating and advice, but it's lots of calculations and science behind everything to make sure what they need. But then it's not just, so I work on neonates, but there's also the general side of pediatrics where that involves all different health disease states. So it can be, you can have areas of diabetes where we're involved, renal, so kidney failure, children's with gut problems, so if they have IBS or inflammatory bowel diseases. So there's a wide range where we have input into. So lots of different specialist areas and lots of different things that one can get into.
So it sounds like even just within pediatric dietitian kind of role, there's really broad kind of opportunities within that to do types of things.
Definitely, yeah.
Wow. Okay, thank you.
Sure.
So my next question is for Georgina. So why would people need to see a speech and language therapist? And do you need to specialise in particular areas in that field? Oh, sorry, Georgina, you're on mute.
So I was just saying, before I actually trained to be a speech and language therapist, I didn't actually know all of the areas that we work within. So I think what sprang to mind for me was people that stammer and children with speech sound difficulties, which is definitely something that we do. But we also work with people across the lifespan, actually, with communication needs. And like I said before, also swallowing difficulties. So I'm just going to give you a little bit of a list of the areas that we work in. So newborns and premature babies with feeding difficulties. Like I said, children with speech sound difficulties. Children with developmental language disorders, so that's where they've got difficulties learning and understanding their first language. People with cleft palate, people who are deaf or hearing impaired, people who stammer, people with learning disabilities and autism like myself, people with mental health difficulties, stroke survivors, brain injury survivors, burn survivors. You know, it just goes on and on and on, dementia, people with head and neck cancer. So it's a really, really broad field, and the list goes on and on, to be honest. So in terms of perhaps what I do within learning disability, so as Adela's already said, a lot of the people we work with have communication needs and also swallowing difficulties. So about 90% of people with a learning disability have a communication need. So that's pretty huge. So kind of the work I do, I work with people with difficulties understanding, people who've got difficulties expressing themselves, even people that are non-verbal. So what I look at is how can we support that person to communicate using other means. So that might be sort of using pictures or signs or technology, that kind of thing. So yeah, it's a huge field. In terms of specialism, on your course, you do placements with both children and adults. And once you've finished your training, then you get the opportunity to choose whether you want to work with adults or children, and you kind of choose your specialism at that time. However, like if you do change your mind later on, there's lots of people I know that have kind of jumped between, you know, different specialisms throughout their careers. So that's absolutely a possibility as well. So yeah, I think that answers it.
Thank you very much. And thank you. Yeah, again, really broad. And I suppose it's probably the same thing with physiotherapy. So my question to Jude is, do you have to specialise in a particular part of physiotherapy? And how do you choose which area you want to specialise in?
Okay, well, much like everybody else has said, that is a massive, massive subject. So I was going to say that physiotherapy deals with everything from birth to grave, but actually having listened to one of my colleagues here, it actually is before birth often, or at least people who have arrived a little earlier than they were anticipated. So neonates, again, will have some physiotherapy as well. So it's a huge, huge area, and you can specialise in whatever you want to. So it can be, my colleagues currently are doing everything from treating outpatients. I, in my early days, was a football physio. I've since then I've been an educator. I've been a boss of the physio department. I've been a boss of the therapies department, and now I'm a consultant. I've worked abroad. I've worked in England. I've worked everywhere. So you can do so many different things. How you choose it just depends on your preference. So when you're an undergraduate, you will go around all of the areas and you'll get an idea to have a bit of a taste of all of them. And you will decide what you want to do. But it is really, really broad. For instance, some of my colleagues have been working on ITU and during the COVID, treating the patients. In fact, all of my colleagues have been working on ITU. Some of us just as helpers, turning the patients, but some of them actually there because that is their specialism and respiratory is their specialism. Now I'd be terrified and was terrified to look at the respiratory patients, but I am a specialist in musculoskeletal. So you start with a remit that is that broad and you know that much about it, and you end up with a remit that's broad and hopefully you know that much about it.
And is there an area, Jude, that you prefer of all those areas that you've worked in within physio?
Well, I've landed up in orthopedics doing shoulders, so I guess I should say that. But I have been a knee specialist along the way. As I say, I loved my football time. I just think I'm too old to be running about a football pitch now. So yeah, I've loved it all, actually. I have really, really, there's not been a day in my life when I haven't wanted to come to work.
And I'm sure a lot of people can't say that. So that's a good thing to say. Thank you. That's really interesting. So a question now from Michelle S. So what kind of skills and qualities do you need to be a hospital play specialist? You know, what do you need to know about? And what is it like really doing that job?
So the main skill I would say is patience. And to be empathetic. You are dealing with people that are very vulnerable, families and patients. They are very vulnerable, they're very scared, and often everyone else are part of the MDT, which is the multidisciplinary team, which is like the other people that have spoken here, the physios, the OTs. They are wanting to achieve something from these patients. And of course, as soon as somebody walks in and says, right, I need you to do something, if a patient is scared, their fear increases. So my job, to make my job easier, you do have to be quite tactful, quite sensitive. You know, you've got to be a bit warm. You've got to show that you can care. And if you like, prove it that you can care. Your communication skills have got to be really on point, because everyone's understanding of a simple sentence is not the same, and what you say to, not even in the same age range, we all are so unique, and you just can't have a standard way of saying something to one person that's going to work for everyone. You've got to change your technique. So good communication, good listening skills, the ability to sort of motivate children that are shy or they're unhappy, quite a lot of energy. You've got to be enthusiastic, or at least appear to be enthusiastic. Quite a lot of sense of fun. There's you know, being able to have a bit of a laugh, bit of banter within, you know, professional guidelines. Some medical knowledge. I've worked at my place of work for 27 years, and so for 27 years I've been absorbing orthopedics, and it does help, because children will be asking me, that doctor just said about the femur bone, what's that going on? And so a basic medical knowledge that you then build on with your years of experience. You've got to be resourceful as well, because no plan ever runs true to form. And adaptability, and you've got to be quite independent in your own organisational skills, because no one's going to turn around and say to a place specialist, right, you need to do that, and then you need to do that, and then you need to do that. You have to take a little bit of responsibility and think, right, where's the need of my patients? That's where I need, that's the first need, I need to go there first. That one can wait a little bit. So you've got to be able to sort of prioritise and plan your day, but just be, you know, make sure that you're looking as if you're looking after them, really. That's what I think you need So I hope I have. And my day, it's sort of, so we're an orthopaedic hospital. We aren't an emergency. So all our surgeries are planned. So patients will come in. So we had 15 in this morning, and I saw 15 patients before they went to theatre, answering questions from, am I going to die under the anaesthetic, to what do you mean you're going to drill my knee? So it's explaining anaesthetics, it's explaining surgeries. Every patient does the nodding dog. When a doctor is talking to them, they go, and then they walk out and they go, what did that mean? And my job is to make it understanding. The play bit comes in. If I'm doing it with a 4-year-old, I'm going to use a gas mask to play with their teddies to send them to sleep. But with adolescents, it's just talking through and making what the doctors have said to them more accessible to their stage of development and their age. And then I move on to looking after the inpatients, talking to the nurses and saying, right, who's having something horrible done today? Is it a blood test? Is it chest drains being taken out? Are they afraid? Let me explain the actual process and literally break it down bit by bit by bit. This is what's going to happen first. Then this is going to happen. Because often a lot of anxiety about what is happening in hospital is about ignorance. That's sort of my main day. My day is responsive to the needs of the ward and the needs of the greater MDT. So I might have a speech and language person saying, this patient's really not eating and we need to encourage that. And I can do that in a fun, non-confrontational way and get kids to do things that they don't even realise they're doing it. And it's like, right, tick, they've done that. Work very, very closely with the physios, being an orthopaedic ward, getting kids up out of bed, trying to make it worth their while to get up out of bed by making their life a bit more interesting. In a nutshell.
It's really interesting because when you think how scary it is for an adult to go through those things, it's imagining what that must be like for a child, and actually being able to help them through that must make such a difference.
But an adult will just go, okay, I don't like the sound of that, that scares me, but I'll do it. But a child will just go, no, and you've got to cajole. And so that's my role.
Fab. And you said you've been doing it for 27 years.
Yes.
What has changed over that time, if any? I imagine things have changed, but
yeah, they have changed. Length of stay
has changed.
Yeah, length of stay in hospital. So now we will do a spinal fusion, which is a correction of a scoliosis, and if it's a 1-stage fusion, they can be out of hospital in 5 days, whereas before, when I first started, that was at least a 3-4 week stay in hospital. Parents all stay on the ward now, which has its challenges as well as its benefits, because you're dealing with the family's anxieties as well as the patients. There's very much more an emphasis on the MDT and on the holistic approach to the child. We're not just dealing with the leg, the spine. We've got to think about their mental well-being. They've got to think about their family dynamics. Are they being bullied at school? All that will have an impact on how they recover in their surgery. So that's very much changed over the years.
Thank you. That's really interesting. So my next question really works around this year. It's obviously very difficult for everybody, but let alone those who work in the NHS. Rupa, I wondered if you could tell us a little bit about how COVID has changed your role, and whether you think any of these changes will continue once the pandemic is over.
So in my role as a clinical psychologist, COVID has changed the ways that I work, in that a lot of my work has had to be done online. So where that involves working with a client, working with a patient or a client, it's made it really hard, especially when you're working with people who find it difficult to put what they're suffering or their problems or what's going on in their life into words. So I've worked a lot with my colleagues, such as the speech and language therapists, to help me. Already I was doing this, but help me really understand, how does this person communicate? So there's the things about what people say and what they do in their body language that I could still perhaps see over video. But what I'm missing out on is the sense of the person in the room. So often, as a kind of, especially in some approaches of therapy, such as psychodynamic psychotherapy, you depend quite a lot on how the person makes you feel when you're in the room. So if somebody's anxious, might notice that I'm starting to feel anxious. Or if somebody's angry, I start to notice I'm getting quite animated and quite bristly. And that's useful work, intelligence to me to bring back into the assessment, to think, you know, somewhere in this narrative or this story the person's conveying to me, there's something in there that makes them feel really angry, or there's something in there that makes them feel really anxious. And also then you can judge better about what's okay to say, what I might say for another time, what I must act upon. So again, there's something about risk. So it's quite hard when you're online to figure out the risk, because people often will tell you, even to a psychologist, that they feel better than they actually do. So again, that has been really hard. And again, what's the beauty of working in a lovely MDT like ours is if I leave a conversation thinking, I don't feel comfortable that that person really is safe, that I then would have colleagues in safeguarding, or psychiatrists, or maybe a community nurse or an OT who's already working with the person, or who's able to sort of support in thinking about that risk, and perhaps even to do something practically to reduce the risks with that person. So risk assessments have become really difficult to do. And also, as a psychologist who works in the community, I rely a lot on what I notice about people's environments. Sometimes we have a formal assessment that's about looking at a person's environment. OTs do too, which is not unique to us. But for me, part of my assessment and part of my would be about, problems are not only mental health problems, or distress is not only located in the person, or sometimes not located in the person at all. Sometimes it's to do with the fit between the person and what's going on around them. And you can't pick that up if you can't see that environment. So home visits, seeing people in college or at school or in a day centre, or out and about where they usually spend life, that's extremely useful information to me in terms of sort of knowing quite what goes on, or quite how something happens. A lot of the referrals that come into a psychologist from a learning disability service are usually around behaviours. The person's injuring themselves, or they're sort of aggressive towards other people, or they've destroyed furniture or something. So a lot of people's expressions of their distress seem to be communicated through behaviours. And so a referral is often about challenging behaviours. So again, without being able to see them in that environment or talk, or, you miss out on a lot of really rich information. So that has been really tough. So risk, missing out on information about people's natural settings and where they spend their lives, where they live their lives. That's been difficult. And not being able to pick up a sense of the person in the room. That's been really difficult.
Yeah, I think we can all understand that. And actually we've all had to get used to, doing everything on a screen, and you, like you say, you just can't pick up on the complexities of behaviour when it's through a screen necessarily. I think that's really interesting. So thank you everyone for those questions that we've had answered there. So we have got some questions from our audience. So I'm just going to have a look at those now. If C could ask those questions, and hopefully some of you will be able to answer those.
Okay, all right. Okay, there's a question here. I do BTEC Health and Social Care. Would I be able to still be a mental health therapist? Not too sure who this question is for. Mental health therapist. And the person is doing BTEC. Anybody wants to answer that one?
Yeah, I would. I don't mind. I would look up on, so with a mental health therapist, if what you're getting at is a psychologist, then I would suggest that you look at the British Psychological Society's website, because there's a few different types of psychologist that you could train as. Most of them require a doctorate level training, and to get into the doctorate level training, you usually have to have a degree, or either a Bachelor of Arts or a Bachelor of Science. It's not the case for everything. So for counselling and for some other types of mental health graduate, IACT, which is improving access to psychological therapies, often employ graduate mental health workers. I actually don't know that career path very clearly, but I would look into what you need for a graduate mental health workers, because I'm fairly sure that's an undergrad level qualification. But often that's the springboard then to think about whether you want to do further training in working with people with mental health problems.
Would the degree be in a particular area, Rupa? Do you know? Would it be in psychology, for example?
Yeah, so if you're looking at psychology, then it must be a psychology degree.
Mm-hmm.
Again, there are certain other degrees that have a big enough component of psychology. So it's usually something like psychology and zoology or psychology and anthropology, where you need to check whether it has graduate, I think it's graduate basis for registration as a practitioner psychologist. I'm getting my terms a bit muddled because it's changed. I've been qualified for 20 years. But basically, if you looked at the British Psychological Society's website, it's called GBR. Your undergrad degree must get GBR status for you to then be able to use that to train further.
Yeah, and I think in terms of the BTEC, from a university admissions perspective, we accept BTEC onto all of our degree courses, but different universities will have different requirements. So some you may need to have an A-level in order to get onto the degree course of a psychology degree, but some will accept BTEC. So if that's kind of where the question was heading in terms of the first step, in terms of getting a degree, then that's your answer there. It would come down to individual universities in terms of whether they accept BTEC on that course.
So then it's always worth isn't it? It's always worth checking what the admissions are for that particular university or that particular course. Yeah. There are also some great voluntary sector training schemes, such as Place to Be, where you can train as a sort of school counsellor. And again, it's pretty robust training. So it's worth looking at some of those opportunities as well.
Thank you. That's really helpful.
I've got a staff member who has gone on, she's already got a degree. She's been working as an occupational therapist assistant, but she's gone on to a mental health and wellbeing trainee with BEH Mental Health Trust. So that's another route to actually take forward the mental health qualification.
Thank you. That's good to know. Z?
Yes, we have another question here. Probably we only have time for one more question. Yeah. So I'm not too sure if anybody here has experience working in Great Ormond Street Hospital, but the question is that how easy or is it hard to help children with the equipment that this hospital have? It's probably more on maybe your experience of working in a general kind of a specialist hospital like that. Anybody has experience working in a hospital?
Yes. So the main thing with working with children is that no 2 days are the same, and with that, no two patients are the same. So with the equipment that you have, you would go in with a certain plan and then find that you'd have to change it again. So for example, if we try to do, say, an EEG, if it's a 2-year-old patient, how can I explain that? Okay, so I'd have to, for example, simplify my language, come in with a great big smile and just take my time step by step and make sure that they're first at ease, they understand, and then I can carry on and help them as best I can. And this goes with everything that I do. And so the course itself in Middlesex University, I actually trained with adults. So when I got my first job here, I had to then relearn how to apply all the knowledge that I learned to children. So that was a source of further training there. But again, that would be placement dependent based on the course. Okay. But to answer the question, yeah, it's just a different approach, a softer approach and a considerate approach with the child's best interests always at heart.
Thank you. So I think that's all the time we've got for any questions. And I just want to say thank you so much to our panelists, because I think I've learned so much myself from listening to all of you and all the different things you do within your roles and within other roles kind of in your areas. If we haven't managed to answer all your questions, talking to the audience at home, there is a website, Step Into the NHS, which has lots of useful information on all the careers within the NHS. So you can go there for some support and for some help. So yeah, thank you everyone for watching. Thank you to our panelists, and yeah.
Before we leave, we've still got to ask our attendees to fill in the poll. So it's up now. Probably I'll leave it here for about a minute. So students who are in this room, can you please fill in this poll, please, before you leave?
Nikki, we were just talking before the session about people being able to email us questions as well. So I don't know who's going to share the email addresses.
I think we can probably send that in the email after this session, that we'll send students who attended an email with the recording, I think. So in that, if everybody's happy to share their email addresses with Anjali or someone from the Middlesex team, and then we can kind of send those on, and anybody who has any questions can then come back.
Okay, thank you. Everybody has answered our poll question, and that's it. Thanks a lot. Bye-bye. Have a good evening.
Bye.
Bye.